Liposuction has come a really long way. There was a time people thought liposuction, you did it because you were overweight. And now there are people in great shape, good nutrition, and no matter what, they can't get rid of a small bulge of fat.
I'm feeling very anxious when I was waiting in the waiting area. The temps were going really slow. You can have your regular meal, whatever you like to have in the morning. I went really light. I went with a baked potato with sour cream. I look forward to this procedure, and I can't wait for the results.
Hi, Maria. Okay, you ready? Okay. So I'm just going to mark you, and just mark the little spots in the back, okay? And then I'm going to lie you down and ready to go. People are now calling it micro-liposuction or designer liposuction. You need to mark the areas, and you need to show the patient. Okay, that's great. Now, that may be the most important part when you mark a patient, because during the surgery, it's easy when the patient's lying down, you sort of get lost in terms of what areas you're going to suck out. Obviously, the key is to make them very symmetrical. And I'm going to mark it again with an X, the area that we really have to concentrate on.
A little creepy with markings. I think most of them are self-conscious, in the back of their minds. You always wonder how you can correct something. Look forward to those areas not being as prominent as I see them now in the pictures.
Hello. Maria, how you doing? You good? You excited?
Very.
With micro-liposuction, it's all local anesthesia. And the key to local anesthesia, first of all, it's not invasive. During local anesthesia, the patient sort of plays a role. It's great, and they feel better. Okay, when the patient's able to talk to the surgeon, and very often when you're IV sedation or general anesthesia, you're always a little afraid. First of all, you may not wake up, or when you wake up, you're going to sort of be out of it, and you're also wondering what you're going to look like.
I think it's going to be great to be awake during the procedure. I mean, very much aware of what's going on. It gives me a more sense of control.
Stop. Anything, Maria? At some point, they're totally numb, but I always ask the patient over and over again, because you certainly don't want to start the procedure and they're not totally numb. So ready to go. You're going to hear a noise, and the noise is going to sound like a vacuum. Okay? Don't get nervous with that, okay? And you may also feel a vibration. Okay, here we go. Here's the fat. Okay, it's all coming out. Your McDonald's burger, and with the Big Mac and French fries. You had quite a meal that day. You know, it's interesting when you do under local anesthesia, you have to know a lot of jokes, because you're talking to the patient for 2-3 hours, and you need that dialogue. Some physicians that do it under IV sedation or general anesthesia, they find it much easier because the patient's out, they don't have to talk to them, it's in, it's out, but we really have to communicate with the patient. It looks like you're going to fit really well in those low-rising jeans.
Oh, good.
Nothing hanging over those jeans anymore. And you may need a belt.
Sounds like a plan.
Okay, Maria, you want to see the fat? I'm going to show it to you anyway. Okay. When you show the person the actual fat that's coming through the plastic hose, most patients are excited, and they tolerate the procedure much better. That's pretty exciting. I get excited to show them, but some patients, they don't want to see it. For whatever reasons, they keep their head down, and they don't want to see it. Okay, and then what we're going to do is stand you up, and then I'm going to look at the areas, and I'm hoping they're perfectly symmetrical. One of the most important things is you actually could stand the patient up. In the middle of the procedure, you could stand them up, remark them, and as you may or may not know, that gravity plays a big role. If I lie down, I don't see my belly, and if I stand up, it certainly gravity pulls it down. So people look much better when they're lying back. Okay? One side, it looks like one side I took out a little more fat than the other. I still have some ways to go on your right side. Okay? What I'm going to do is sit you down again and lie you down. Okay? And then I'm going to do all the areas that I marked, and I don't think are perfectly even. Okay? A lot of patients, because it's relatively simple. There's no downtime. It's a local anesthesia. You start out in one area, and then they want to do another area. They all want to reach perfection, and you have to be very, very careful, because you don't want that patient to become a cosmetic junkie. Okay, so we call it a day. Oh, let's see the front. I want to look at your
the front. Right.
The front looks good? Yep. Okay.
Lift your elbows.
You can look at the front.
Oh, wow, bravo. Good, there you go.
Okay. Okay, so we're going to lie her down, and then Chris is going to clean her up, and then put on the bandages. Okay, let's call it a day. Okay, thanks. Okay, I'll be back. He will come back in about a week, and she'll get like lymphatic drainage. Well, they'll push the fluid out and sort of massage her, and what's going to happen is the fluid will get out a lot quicker than if she just did herself.